Hello Kenyans, hello everybody, hamjambo. Kenya yetu hakuna matata, but maybe kuna matata kidogo in the section of healthcare. And I think as Wangari Maathai said, what is your little thing? She invited us in her era, in her lifetime, that do one little thing. And she gave a story of a hummingbird. And she would say a forest was burning and there were all kinds of wild animals in the forest. There was the elephants, there was the lions, all kinds of animals, big, small, long, snakes and all that. But a little bird called the hummingbird decided, now that the forest is on fire, I will do something. I'll go to the river and fetch a little water with my beak and bring it to put out the fire. And the other animals were just laughing and thinking, what do you think you're doing? What do you think? You think you can put out the fire? And the bird said, well, it doesn't matter, but if I can save a little insect, I will have done my part. And so after the other animals saw the effort, they joined in. They joined in to contribute into putting out the fire. So in our case, I have been thinking about the diabetes patients and the chronic diseases. And it's as serious as I've been holding the discussions with them. And one woman said, it is a real burden. It is a real burden to us. When I have to inject, insulin, I don't even have the money to buy the insulin. I don't have the money to pay for consultation. I don't have the money to pay for the clinics. It costs so much. And when I think that I have to go to the doctor for $200, 200 shillings checkup, I'd rather buy food for my children. And so that's where you and I come in. And one of the things that I've been doing with the people in my village is contributing at least to offer free checkups. You can, provide a BP machine and a glucometer in your village so that all these people, they can have early screening at no cost to them. They can have routine checkups at no cost to them because they are trained community health workers who will do whatever a doctor would do, who will be with these patients, who will create support groups. You can imagine when a woman tells you, I feel so bad that I'd rather have HIV than have diabetes. Why? Because everything, every cost that comes with diabetes will come through my pocket, will come from my pocket. But somebody who has HIV, they have free medication. They go to free clinics. Sometimes they have their doctors visiting them. And that is the truth. And worse still, if they happen to die, their children will be taken care of because there are so many organizations who take care of widows orphaned by widowed from HIV, orphaned by HIV, or that they get their education for free. But who is taking care of us? It is going to be you. You're going to be that hummingbird. You're going to be that one person who can contribute, at least, even if it's in one aspect, save these people from their hospital visits. And like the kind of dialogue I've created is you can have dialogues in your community, provide those kits, the first aid kits from Red Cross. It actually costs 8,500, and the glucometer and the BP machine, they are 4,000 and 4,500 each. And those tools will help these people, will help the village at least create the prevention for some of these chronic diseases. And the complication that would come with diabetes, I've seen people being amputated because it went too high, and they create other complications like diabetic neuropathy. One of my neighbors actually lost their legs because of such kind of complication. But we are the people to educate them. If you cannot offer tangible help, you can offer services, you can offer your intellect, you can offer your insight, you can offer the knowledge that we've gathered over the time, and you can provide that one glucometer, that one BP machine or that one blood pressure kit, and give these people moral support, spiritual support, economic support, and let's work together as a team to create the kind of Kenya that we would love, to save those people, to relieve them at least of one burden, even if it's save them one trip to the doctor. Like one woman said, should I choose? I have to choose between going to the river, feeding my children, or just going to that doctor's visit. And I have had this constant headache. And those who have been in healthcare would know that if you have constant headache, it means that maybe you have issues with your blood pressure. And so this woman noted that she had high blood pressure when it was way too late. So all through she had chosen to buy a Panadol to cool down the headache, when if she was able to check if there was somebody doing the rotation in the home, then they would have saved this woman from those kind of complications. So it will call for you, it will call for me to offer that little help, like that hummingbird. We just offer that little help. We go that one extra step, and it goes a long way for these people, and it also goes a long way to you. One of the things that really made me passionate about this, of course, it is the death of my dad, which was really painful, and also being a community leader and talking to so many people in the diaspora who are losing people every day, from maybe things that could have been prevented, but nobody really paid attention to it. But I feel it is at our time to arise. It is our time to come together. It is our time to create that change that we desired. And so, thank you guys. Thank you for listening. Thank you, even as you allow that seed that has been deposited today to grow in you, and to put our hands together. Thoughts are welcome, contributions are welcome, and if you want to reach out, you can send me an email on pickingpieces@gmail.com, and we can have the discussion. And pretty soon, I'm actually going to create a Facebook page called HealthCare 254 so that we can discuss these things and we can look for the solutions. Thank you, and God bless you. Jambo, Kenya, hakuna matata.